We know conversely that a good diet containing larger amounts of omega-3s and polyphenols, an anti-inflammatory diet, is associated very strongly with improved male and female fertility. And one of the reasons for this is that the process of sperm formation and egg formation you can think of as a kind of very controlled inflammatory sequence. Too much inflammation disrupts that process. But there's structural things going on here too. We know that DHA, the fatty acid, is itself built into the head of the human spermatozoa. We know that omega-3s lead to improved sperm quality, quantity, morphology, and movement. And we know that they improve oocyte quality. These are the this is what gives rise to the ovum and extends fertility. At least in preclinical studies, there is some clinical evidence for this too. And we know that polyphenols play a similar role. So the mechanism kind of fits. It fits the epidemiology. For people who are trying to conceive, balanced soil, I think, is actually a very important part of a fertility-enhancing program. During pregnancy and lactation, I think you all know that the developing fetal brain in the third trimester, perhaps the beginning, the end of the second trimester, and in the first year after birth, it's developing. It needs large amounts of DHA, but it needs EPA too. But for the mum as well, it's a pretty good thing to have balanced oil because we know that omega-3s reduce the risk of preterm labor and delivery. Now, because the fetal brain really needs these omega-3s, if the mother's diet doesn't include significant amounts of fish oil, and she doesn't have enough of these omega-3 fatty acids, the baby will steal them from her. If there isn't enough in the plasma, the baby will actually steal these fatty acids from the mother's brain, where they're stored. And so we see that in mothers who don't have good nutritional status to begin with, their brain actually shrinks in the last trimester because the infant is pulling all the omega-3s it can out of the reserve of its mother's brain so it can use them for itself. And this is implicated in what is known as baby brain. For those mothers who are in this situation, they become more forgetful. They actually lose a few IQ points. The brain is actually shrinking. And it's very connected also to pre- and postnatal depression. So balanced soil is a good thing for the developing baby. It's a good thing for the mum as well. And there is good work now. Some of this was done by people who are linked to my institute, the Institute of Food, Brain and Behavior. Professor Michael Crawford did a lot of this early work, one of my heroes. And he showed that giving omega-3s to very young infants, especially preemies, premature infants, helped them with visual and cognitive development. This is recognized by ISFAL guidelines, and they say that during pregnancy and lactation, mums should be taking at least 300 milligrams of DHA per day. EPA is also important. I think it's actually not a very good idea using these as omega-3s individually. And moving seamlessly on to toddlers and teenagers, their problems are a little different. For those of you